And I'll put the DOI of the paper we published. So we wanted to have a peer support because our background literature showed one of the reasons people are not showing up, you would send them to a facility, you send them to Chogoria from a smaller facility, they come up to the gate, they feel intimidated and they turn away. They don't even know where to start. Navigating was an issue. Then this thing about someone to talk to and to encourage me and to nudge me. And then just being confident that the referral is a good idea and I can hack it. So we thought, what if we had a peer, someone we called a peer navigator, to receive people at these facilities where we're doing the work. And then we realized the IT matters. What if there was a way, when Matthew is sending a patient to another facility and he's sending to Paul, there is a way they can communicate, not only the providers, but also the peer navigators at the two sites. So that was the hit. So we did to improve the communication, the decision support, and tracking to make sure we can see what's going on. So yeah, and then it's up the tier, and it's going two ways, so that we wanted the patient who was doing better, they are moved from tertiary and they are moved towards the dispensary to reduce the crowding. So there's a lot going on in that project, but we are focusing on community engagement. So I don't know whether this is clear. I was involved in mainly the community engagement, and all those partners, we marked them and said they are important. So we had the AMPAT Research Office, the NCD office at AMPAT, we had the healthcare professionals, the patients themselves, the communities at large, we held Mabaraza with them, and the sub-county and county officials, all of them to us were important in this. And then we used this particular International Association of Public Participation framework to guide us as we were organizing. You were asking, how do you publish qualitative data? We actually just looked for the framework when we wanted to write the paper, because we realized we had engaged all these people, but we didn't know how to tell the story. So we did that, and this is, just look at where there's blue. So this is summarizing the stakeholders, identified the purpose and the method we used to engage them. So you see, we already had decided we wanted to be community engaged, so we had to think about that. And you can see, we wrote for permission, we called, we sent emails, we followed up, you name it. You will have the paper so you can see that. And this is me. We went to all the sites sharing the findings with the healthcare providers at the facilities where we had worked. I don't know that it's clear. Yeah, I used to look smaller. So that's in Mosoriot, one of the sites. And I was introducing the project, and then this was Webuye, the other site. Oh, recently we were told you can't use identifying data. So I realized I've been using this picture, although they had said, now when I do that, you can't see their faces. So I just left my face. Yeah, so that is Webuye. The other one was Busia. And they were so happy. They said, people don't come back to tell us what they found out. We did it, and we even arranged for tea. And there was, because they also give you feedback about the study, and you collect more data. So what are the advantages? We've seen when you use a collaborative process, people own the project, and when you show up, even when your research assistants come, they just see the badge says strength. They say, oh, it's those guys of hypertension. Hi, how are you doing? You know, and they even send greetings back. So you break ice so easily. There's co-learning. It's action-oriented, and we're building capacity even of the healthcare workers and helping them with their referral guidelines and things like that. We wanted to give, because it's implementation science, we wanted to give back even as we did our work. So it enhances that ownership and empowerment. But there are challenges. It's not easy, and I think Bramwell even started flagging some of those things. It looks very romantic, but it's not Valentine's all the time. You have to think through it, and it takes long. Like now, we've been working in Kilifi for donkey years, and also in Western Kenya. When you show up, they even just ask, are you from AMPAT? They even think the people who were there last week have something to do with you. So if your people go and mess there, it's also bad. But I think it's still worth investing in it. It's really worth investing in it for ethics. We're talking about community and research that is ethical. Because you want to meet the needs of that community. You want to do it in the way that it makes sense. They might tell you, oh, just do video clips. And in Swahili, then come and share in the baraza. Just show us that film. Nobody will have maggots again. You know, ask them what mode, what medium, what time, when should we come? There are some places they tell us, we are planning.